Good morning, everybody. Here I am at 5:20 in the morning getting ready for work. I start by washing my face and then I brush my teeth and I also brush my tongue, but I didn't show that. I also look at my hair every day just to make sure it's doing all right. And then once I do that, I go to my room to get ready for the day. Here I am doing my skincare routine, just applying some serums, some lotions, and doing my makeup. I'm definitely the type of person that gets ready for work each and every single day. I love doing my makeup for work. It just makes me feel ready for the day. It makes me feel confident. It makes me feel happy and excited. So it's definitely a feel good, do good mentality for me. So once my makeup is all done, I go ahead and put my scrubs on. I start by putting on my shirt, then my pants, and then my jacket. So here is my makeup and then my scrubs. They are the Cherokee brand and they are my favorite aside from my figs. Here is my drive to work. I promise I'm not speeding. This is just sped up. But yes, every day that I drive to work, it is dark in the morning, and that is really, really hard for me because I'm the type of person to always be sleeping in. But here I am in my operatory. This is actually not my operatories, it's another hygienist operatory, but I decided to use hers. I'm just setting up for my first procedure of the day. Really, really excited, getting the numbing jelly ready, the anesthetic ready, and everything. And then I put my loops on. Super thankful each and every day for these loops because my neck and my back would not be doing so well if I didn't have them. For those of you wondering, I do have the Q Optics brand and I've had them since hygiene school and they are absolutely amazing and I have yet to have any issues with them. So after that, this is me telling you I'm gonna put my hair up, but there's my hair up in a clip. And here is my dad putting on his sunglasses. He is my first and only patient of the day. I love how happy I look. You could just see me smiling. Just getting him all prepared and set up for his appointment. So this is actually my fourth time seeing him because I'm working on one quadrant at a time. I'm putting on my gloves because I am going to get ready to give him his injections. I first start with some numbing jelly in my insertion sites. I gave him 2 injections at this point. I gave him an inferior alveolar block and also a long buccal injection to numb all of his bottom teeth on the right side. So here I am going in with my injection using a long needle, 27 gauge, and going in my insertion site, and I like to go in really nice and slow. I aspirate to make sure no blood comes through my needle, and then I administer the anesthetic very nice and slow. Here's me doing a happy dance because that injection went really, really well. And I was just asking my dad if he was starting to feel numb in certain areas, and he said yes, so I was really happy and excited. So depending on what injection you give, different parts of the mouth and face are going to feel numb. So it's always really important to kind of check in with your patients and see how well it's doing. So here he's pointing to the areas that are feeling numb, and he's telling me that his tongue is starting to feel numb, which was perfect because these are the areas that I needed to feel numb. So then I just like to go in with my Explorer and kind of poke around and make sure that he feels nice and numb. Typically, this lower injection takes a little bit longer to penetrate the jaw compared to the top. So here's me working in the very back because that's where he felt numb, and then I was just giving the anesthetic time to trickle forward to his front teeth. And throughout the video, if you see me looking back and forth, I'm just looking at my x-rays here. That way I know exactly where to focus, and the perio charting, so I know how deep to go into the pocket. Here I am just switching my tips. I typically start with a thicker universal ultrasonic tip just to really break apart those big calculus chunks, and then I go in with the triple bend to kind of fine-tune things. I'm more of an ultrasonic girl. I will ultrasonic majority of the time, and then I'll just hand scale afterwards to smooth everything out. I do this because obviously I let the ultrasonic do the work for me. I'm not going to sit there and hand scale a large piece of calc for hours and hours and hours. So that was just my dad telling me that he was still feeling a little bit of the treatment, and this happens a lot of the time where you just have to go back in and put more anesthetic, especially if people have a lot of infection and severe periodontal disease. Sometimes the anesthetic can't penetrate through the tissues because of the acidic environment. And to be honest, this kind of stuff happens all the time, so that's why I'm not even nervous about it. When I was back in school, that would have freaked me out. It would have made me start sweating and pass out, but I'm used to that kind of stuff. It's just a matter of putting more anesthetic in locally, infiltrating in some areas, and you'll be fine. Here for preventive measures, I'm looking at the x-ray to see where his mental foramen is. I was just going to give him some extra anesthetic there just to make sure. This is why I love panoramic x-rays, because you can see exactly where the foramen is, so you know exactly where to insert. Love me some x-rays. And then I just massage to push the anesthetic through the foramen. And there I am, back to work. I tried to give you guys a close-up to see what I'm doing so you could see how deep I was going, but I couldn't really get a good shot. After I'm completely done using the ultrasonic, I just go back in with my hand instruments and make sure everything is nice and smooth. Even though this video went by really fast, this appointment was actually an hour and a half long. Anyway, here I am just giving my dad a little bit of post-procedural rinse, some chlorhexidine for him to rinse around with. And here are his teeth, nice and clean. ¿Cómo te sientes?
Bien.
¿Cómo se siente que tu hija te está haciendo tu tratamiento?
Me siento muy a gusto, con más confianza y pues con mucho orgullo.
¿Sientes bien dormido?
Nomás un lado de abajo.
Y compara esta vez, o sea, esta vez con cuando te hicieron el tratamiento allá en la otra oficina.
No, pues sentí menos dolor y pues más confianza, y pues todo eso tiene que ver mucho porque te siento nomás a gusto.
Bueno, bye.
Bye, gracias.
So here I just wanted to show you guys my workstation and then these 3 pieces of calc that I got out from an 8mm pocket. Here you can see them on the x-rays. I was so happy that they came out. Those have literally been there for like 20 years. So here are what his teeth look like now compared to before. These are some snapshots from his iTero scan that I was able to get. Some inflammation here. Also some inflammation there. You can see all the plaque and the bacteria, some inflammation there. And then instead of his gums being red and puffy, now they are nice and pink. So for now, everything with my dad is still healing, but as of now, things are looking really good, and that makes me really happy that his disease is now stabilized. Here I am just cleaning my room, wiping everything down because I was getting ready to leave for the day. So here I am just typing some notes. Also, I just wanted to say that my dad's teeth are like this because he's always had dental anxiety, so he never went to go get a cleaning, and the time that he did, they did a really bad job and basically charged him thousands of dollars for no reason. So now that I am graduated and I am a hygienist, I am able to treat his periodontal disease, which is amazing because I love how comfortable he is in my chair, and that way I can also make sure he gets treated properly. Hi guys, so it is officially the end of my day today. It is currently 9:30 and I am in my car. So while my car is warming up, I'm just gonna update you guys. I only had one patient today. Obviously, as you could tell, it was my dad. The appointment went so good. It was like the best appointment ever. It was amazing. Now I'm just gonna go have breakfast with my best friend. She's also a hygienist, so maybe I'll record whenever we're together. We're gonna be going to Homegrown, and then after that I think I'm gonna go home because I have to do my laundry for the rest of the week. And yeah, it's already such a good day. Fridays are like my favorite day of the week because they're my days off, but I can also come in if I want to. I get to treat my dad on Fridays, so it's like awesome. That was honestly a very simplified version of my day because I only had one patient. Typically, if it was Monday through Thursday, I would have a patient after that and a patient after that. But typically, I see about 8 to 10 patients in a day, depending. Sometimes like 7 to 10, depending on the day, depending on if we have a meeting that day, depending on if I'm seeing kids that day. I'll see you guys at the restaurant because I don't want to be late. Obviously, not all of my patients need deep cleanings every single day, so it just varies. I get really simple patients, I get really difficult patients, all of which are my favorite. I love what I do, and it makes me really happy. After I went home, I totally just cleaned my room and took a fat nap, and then in the evening I went to the movies to watch Avatar with my family, and then I just went to sleep.